Again, thank you for this kind invitation to show us that something that is very exciting for us is the result that we recently published in the Cancer Discovery. So we want to share what published in this journal. So the diagnosis of breast cancer during pregnancies is devastating situation. Now we differentiate between the breast cancer which is diagnosed during pregnancy because have a prognosis very similar to young women with the same histology, and the breast cancer we diagnose during postpartum period because have like probably worse prognosis for two reasons. One of the reasons is because there is a delay in the diagnosis because we assume that in that period something is normal related with lactating period. And the other reason is because probably microenvironment in the breast favored the metastasis in this setting. So fortunately, it's low incidence about the breast cancer associated with the pregnancy, but we know that the incidence of breast cancer increase with the age. And now there is a global tendency to delay the moment to the pregnancy. So probably in the following years, we will have more cases like this one. Everything starts with a patient who comes to the visit to the consult in his third pregnancy. Unfortunately, she was diagnosed with breast cancer, and she was asking if probably in the second child the breast milk have something dangerous for her baby, and we know that not happen. But we start looking what is the study that we have with the breast milk in that situation. At that point in 2017, we know that liquid biopsy was very important for us. For breast cancer also is important for monitoring and give target therapy to our patients. And there is two tendencies. Our tendency to improve the sensitivity to the liquid biopsy. One of these is improve the technique. And the other one is found new sources of the liquid biopsy to increase the sensitivity of the tumor or where there is more shedding of the tumor. So we thought that probably in the breast milk, we can find the tumor. So we have the sample from the tumor, the metastatic, we have sample from the tumor of this patient, the metastatic samples. Unfortunately, we don't have plasma at that situation at that point. And we have the breast milk that we say again, have 18 months before the diagnosis of breast cancer, and we found a PI3K mutation in the tumor. And when we go with the drug digital PCR, looking the mutation, and we found it. So we start collecting samples, and it's the data we publish in the journal, where we had 19 cases, only the samples of the breast milk from 15 cases, and we analyzed with drug digital PCR these samples from the breast milk and also from the plasma. Everything, the breast milk was positive for breast milk in 13 patients, was negative for 2 patients. That we have to say that the colostrum sample for these patients probably had the reason that was negative because was an immature breast milk. And there is one case where the plasma was positive, and this case is with involvement, have another involvement and probably have more shedding of the tumor to the blood. And with that, I want to highlight in 2 cases that we have a lot of mutant allele fraction was higher, and probably because it's a lobular histology, and we know that in the lobular cells is where the breast milk start forming. This is the figure that we published in the journal where demonstrate more easily the results. And also we analyzed if there is something associated with more mutant allelic. So we found the only association with more mutant allelic fraction was the histology, not with the histology lobular, not the size and nodal affections. But we know if we know where we want to look, what happened if we don't know, and we design a panel with 15 genes that usually mutate in breast cancer. Now the panel improved with 122 genes that usually are mutated in 1 or 2% of the patients with breast cancer. And again, we analyzed these samples and we found a sensitivity of the 70.4 in the breast milk. And when we compare with the plasma, it's 100. I want to highlight this case because this patient doesn't have cancer when we come to participate in our trial. And these patients, only the risk factor associated with breast cancer was the age. She gave us samples from the 8 months and the 11 months, from 8 months and 11 months of lactation period. She stopped lactating after 12 months of the from the childbirth. And we followed this patient for 1 year more. 6 months later, we found a lesion in the ultrasound. We biopsied the lesion and were diagnosed with breast cancer, stage 1. So surgery and also hormonal therapy was given to this patient, but she doesn't have to receive chemotherapy. She's safe to receive chemotherapy. So we go to retrospectively to analyze the mutation that we found in the tumor that was AKT1, and we found with drop digital PCR this mutation in the sample of the breast milk 8 months and 6 months and 9 months before the diagnostic. And when you use the panel, we found this mutation 6 months before the diagnosis of the cancer, where the ultrasound was negative for this tumor. So this way we published this article and demonstrate that the isolation of the ctDNA in breast milk is factible with high sensitivity, even in the earliest stage, and even when the ultrasound is negative. And our next step is demonstrate that these have utility and applicability to these patients to the early diagnostic of breast cancer. And nothing is possible with the work from our patient, the people who help us to make all the projects and the study, and the work of the multidisciplinary team. And thank you.